Good morning, I am Anslin, nursing tutor from Emmanuel Arasar College of Nursing. Now we are going to see about hyperthyroidism. Hyperthyroidism is hyperactivity of the thyroid gland with a sustained increase in synthesis and release of thyroid hormones. Hyperthyroidism Hyperthyroidism is a set of disorders that involve excess synthesis and secretion of thyroid hormones, that is T3 and T4, by the thyroid gland, which leads to the hypermetabolic condition of thyrotoxicosis. Thyrotoxicosis. The term thyrotoxicosis refers to the physiological effects or clinical syndrome of hypermetabolism that results from excess circulating level of T3, T4 or both. Incidence occurs in women more than men with highest frequency in person 20 to 40 years old. Causes of hyperthyroidism: thyroid nodules, thyroiditis, excessive iodine intake, Graves' disease, medication. Clinical manifestation of hyperthyroidism: intolerance to heat, fine straight hair, bulging eyes, facial flushing, enlarged thyroid, tachycardia, increased systolic BP, breast enlargement, weight loss, muscle wasting, localized edema, menstrual changes, diarrhea, tremors, finger clubbing. Diagnostic test: history and physical examination, ophthalmologic examination, ECG, atrial tachycardia, laboratory test, TFT, T3, T4, TRH. Radioactive iodine uptake. A radioactive iodine uptake test used a radioactive tracer and a special probe to measure how much tracer the thyroid gland absorbs from the blood. Management: the overall goal in the treatment of hyperthyroidism is to block the adverse effect of thyroid hormone and stop their oversecretion. Drug therapy: antithyroid drug. Indications of antithyroid drug: patient with high likelihood of remission, the elderly or others with comorbidities, increasing surgical risk or with limited life expectancy, moderate to severe active Graves' ophthalmology, soon after starting radioactive therapy for 6 to 12 weeks. Beta adrenergic blockers, example propranolol, inhibit adrenergic effect. Indications: prompt control of symptoms, treatment of choice for thyroiditis, first line therapy before surgery, radioactive iodine and antithyroid drug. Radioactive iodine therapy: concentrate in the thyroid gland and destroy thyroid tissue, high cure rates with a single dose treatment. Treatment of choice for Graves' disease, multinodular goiter, toxic nodules in patient older than 40 years and in recurrent thyrotoxicosis. Surgical therapy: surgical treatment is reserved, patient preference, pregnant women who can't tolerate ATD, child or adolescent intolerant. Thyroidectomy: total or near thyroidectomy for patient with coexistent thyroid cancer, severe ophthalmopathy, life treating reaction to antithyroid drugs. Subtotal thyroidectomy is recommended for the rest. Bilateral subtotal thyroidectomy, in which 1 to 2 gram of thyroid tissues is left on both sides. Nursing management: fatigue related to hypermetabolic state with increased energy requirement, imbalanced nutrition less than body requirement related to increased metabolism, risk for impaired tissue integrity related to alteration of protective mechanism of eye, impaired closure of eyelid. Thank you.